MIOT rehabilitation services have brought a lot of changes in people's lives across the world. Here are some of the most transformative recovery stories from our patients. A 60-year-old woman with a history of bright breast cancer and removal of the breast came with restricted shoulder movement, right arm pain and swelling. She struggled with daily overhead tasks. Through cancer rehabilitation, her shoulder mobility improved, the pain and tightness eased, cosmetic appeal improved, and edema significantly reduced, giving her freedom to move again. A 38-year-old accountant lost his job and became bedbound due to activity-induced involuntary movement of muscles affecting his face, neck, and all 4 limbs. He was completely dependent on others and struggled with intense pain. His customized rehab plan included cognitive behavioral therapy, stretching, strengthening, endurance exercises, and sensory reintegration activities. He progressed from being bedbound to walking independently. An 82-year-old woman with multiple comorbidities came with a diagnosis of community-acquired pneumonia, sepsis, and multi-organ failure. She became completely bedbound with pain, generalized edema, and severe weakness in all 4 limbs. Rehab focused on improving cardiopulmonary and physical endurance. Gradually, she began walking with a walker, regained independence under supervision with no more pain. A 13-year-old boy with abnormal involuntary movements known as dystonia, present since birth due to a lack of oxygen, came in struggling with walking, struggling with speech, and struggling with social interaction. He was referred to neuro rehab as he had poor hip control, limited standing balance, dystonia in both hands, reduced hand function, and unclear speech. His rehab plan focused on easing spasticity and dystonia, strengthening hip and trunk control, and enhancing speech clarity. Eventually, his spasticity reduced, speech intelligibility improved, and he began walking independently. 2 young women, aged 33 and 37, came to us after traumatic limb amputations. One had an above elbow and below knee amputation, the other with an above elbow amputation. Both suffered from stump pain and shoulder tightness. Rehab focused on pain management, restoring mobility, and training with prostheses. Over time, the pain reduced, strength returned, and control and independence were regained. A 59-year-old man arrived bedbound with weakness in both lower limbs, bladder and bowel incontinence, and total dependence for daily tasks. After a spinal surgery, he was referred to neuro rehab focused on motor recovery, sensory reintegration, hip and trunk control, and ambulation. Along with psychotherapy and a low dose of mood stabilizers, his recovery improved. He progressed to walking unaided, regained confidence, and reconnected socially, restoring independence. A 53-year-old man came in with post-COVID pulmonary fibrosis and severe breathlessness even at rest. He had been on long-term oxygen support since 2021 with generalized weakness, poor cardiorespiratory and physical endurance. His pulmonary rehabilitation plan focused on improving respiratory muscle strength, lung volume, lung compliance, along with mobility and activities of daily living. His respiratory muscle strength, lung volume, lung capacity, and walking ability improved. He no longer needed oxygen. Now, with the MIOT Rehab Center in Maldives, patients can receive comprehensive rehabilitation right at their doorstep.